fundamental. In the core, we have personal issues. Personal issues that we are not able to change them. For example, if I was born as a man, I cannot change. I'm not able to change it. Yes. If I was born as, for example, white person or black person, I'm not able to change it. Yes, is it correct? But if you go further, step by step to outer layers, there are some social determinants of health that you are able to change them. Yes, it's not related to our personal issues. For example, individual lifestyle. Who can name some of our individual lifestyles? Who can name some of lifestyles? Eating habits. Thank you very much. Like what? Eating habits. Yes, for example, eating coffee, heavily. Eating teas, heavily. Eating fast foods, great. Or maybe as a vegetarian, yes. But here again, we are able to change it. Yes, we are able to change it. I can choose my lifestyle. For example, I wanna eat fast food. I wanna smoke. For example, some guys wanna drink alcohol. Yes. So it depends on their lifestyles. So they are able to choose their lifestyles. They are able to change their health, their situations. Yes. And it's not related to society. Step by step, you are going to go from your individual issues to society issues. Thank you very much. Thank you very much. And for example, social and community networks. Your health is related to your social and community networks. Yes, for example, I lived in Canada for 1 year. And I had a couple of networks. They were very useful for me because my friends can help me. For example, you are here and as an international student, yes, and your health is related to your community networks. If you don't have any community networks, you don't have any support. It's related to your health. But maybe another person has a couple of community networks. So it's related to his or her life. Yes? Do you agree with me? Thank you very much. And again, for our health is related to our status, to our condition about our employment, our work, environment, our for example, education, yes? So there are a couple of different variables, or maybe general socio-economic, cultural. Our health is related to our culture. Maybe in, for example, in some countries, they don't pay attention to sanitation and health culturally. Yes, you know. But I'm not going to name a country as this issue. But in other countries, for example, in developed countries, they focus and they pay attention a lot for their health, their sanitation, their hygiene, yes? So our health is related to all of them. And in this picture, you see results of a research. The picture says, what makes Canadians sick? Yes. Please focus on this figure and guess what's the message? What's the message of this slide? Who can explain for us? our lifestyle.
Personal.
Are these variables related to our lifestyles? Our income is related to our lifestyles. Our early childhood development is related to lifestyle. No, it's not lifestyle. Again, thank you very much for your cooperation. Yes.
It was the core, right? So that these factors are in the core. That
Of course,
we
there
can
are
change.
different aspects of issue. Yes, you can guess. Thank you very much. Who can guess? Another person? Ladies and gentlemen, please cooperate in class. Here, your life, your health care, your biology, your environment. What does it mean? What does it mean? As we said before, our health is related to different aspects. Yes? Some of them are related to our environment. Yes? Some of them are related to our biology. Some of them are related to our healthcare system. And some of them are related to our society. For example, this gentleman said that environment is related to our health. Yes? For example, air pollution. In Canada, they estimated that about 10% of our health is related to our environment. This lady said that our biology is related to our health. Yes? They estimated that about 15% is related to our biology. Yes? And another friend said that our healthcare system is related to our health. For example, I said that there is a difference between living in Canada or the United States or in Iran, yes, because there are different healthcare systems. They estimated that our healthcare system is about 25% of our health. And of course, the main section is related to our society. The main section. I mean that, for example, our health is related to our income. Is there any difference between wealthy and poor people? Is there any difference of health of wealthy and poor people? Yes, sure. Early childhood development. What's the meaning of? Who can explain about early childhood development and health? Who can guess the relationship between early childhood development and health?
There are diseases called DH, like this very soon activity.
Yes.
And you took some medicines for curing this. Early child development, that means they are in 10 years old, 11 years old, they are developed, very active. Very active.
Yes. Who can add anything? Yes, you.
It's possible that as a child, some antigens are meant to be produced in the child so that it's immunization given to children.
Yes.
Like,
Please know there. Anything.
for, like, example, polio.
Yes, polio. Yes.
This immunization so maybe because the children antigen isn't soon enough to fight against this kind of polio.
Thank you very much. Great. What's your name, gentlemen?
Fighting,
Yes. Frimpong.
fighting.
Fatihu Bul Fatihi. Yes. Salahuddin.
Yes.
Great, Salahuddin. Thank you very much. Yes. Thank you very much. As my friend told, yes, our health is related to education. Do you agree with me that our health is related to education?
Yes.
Yes. in which years there is the most important educational issues for childhood? Yes. If we learn anything in childhood, it's better for us than learning in elderly. Yes. Do you agree with me? So early childhood development and appropriate early childhood development is related to our health. We agree, all of us agree that we should teach our kids about health issue. Why? Why are we going to teach our children? Because it's better for them. It's better for them. It's better for their future. It's better for their health in future. You agree with me? So other social issues like disability, like education, like social exclusion, social safety net, gender, employment, race, aboriginal status. What's the meaning of aboriginal status? What's the meaning of aboriginal? Aboriginal status or indigenous status. Aboriginal or indigenous. In each country, there are a lot of people who live basically like old people. For example,